morning everyone. I'm Mahrukh Zuberi and I'm a third year medical student. Today we will be talking about pneumothorax. Thorax is basically the presence of air between the pleural spaces. Now this can lead to lung collapse or sudden respiratory distress. Now what I'm going to talk about mainly is the causes of this disease. Number one is primary spontaneous pneumothorax. Now there are four types of basic pneumothoraxes depending upon their etiology. Number one is primary spontaneous pneumothorax. Number two is secondary spontaneous pneumothorax. Number three is traumatic pneumothorax, and number four is iatrogenic pneumothorax. The etiology of all four is different, giving them their names. Number one occurs without any apparent cause, that is the primary spontaneous pneumothorax, and it occurs often in tall young males rather than females. Then secondary spontaneous pneumothorax, it occurs in individuals with some underlying lung disorders such as COPD or cystic fibrosis, etc. And number three is traumatic pneumothorax. Traumatic pneumothorax is basically results from chest trauma, for example, rib fractures or any accidental cases or wounds that are deep enough to rupture a lung. Number four is iatrogenic pneumothorax, which is caused by medical procedures, for example, mechanical ventilation or a thoracentesis. Symptoms of this disease include sudden sharp pain, which is a stabbing pain in its characteristic, as described by patients, shortness of breath or dyspnea, and patient might also experience decreased breathing or the decreased sounds of breathing through auscultation on the affected side. Anxiety or restlessness is also common in such patients, and in severe cases, some cyanosis can also be spotted, that is on bluish coloring of skins, and hypotension. Methods basically include two types, that are physical examination and imaging studies. To understand physical examination, there are three procedures: palpation, percussion, and auscultation. Through palpation, we can understand decreased tractile fremitus, and through percussion, we can understand hyperresonance of the affected area, and through auscultation, we understand the absence of breath sounds. Secondly comes the imaging studies, which are very much relevant in this case. In any person experiencing pneumothorax, basic imaging studies are used. For example, chest x-rays, ultrasounds, and CT scans. I can show you a patient chest x-ray. As you can see, there are white spots in the whole area of chest, in the whole mass of the whole mass of lungs. We can see white spotting. This is the air captured between the pleural cavity. For the treatment of this disease, there are four options depending upon the stage of invasion through pneumothoraxis. For example, if the pneumothoraxes are small and asymptomatic, just as we saw in this X-ray, for such cases, pneumothoraxes may resolve spontaneously and on their own, but they require a follow-up imaging. Then the second method can be used as needle decompression. Through this, it is an emergency process for decreasing the tension of the pneumothorax to relieve pressure between the pleural cavity walls. Third method is the chest tube insertion. In this method, for larger or symptomatic pneumothoraxis, we allow this method to drain the air and re-expand the lung so as to increase the cavity and so that the patient can breathe more efficiently. The fourth method is surgery, and it is considered in cases of recurrent pneumothoraxis or persistent leakage of chest tube after the pneumothorax treatment. Now, pneumothorax is a disease which is more common in men than women. Now here I will share with you some statistics related to the same disease. With incidence rate ranging from 7.4 to 18% in about 1 lakh men and 1.2 to 6% in 1 lakh women per year. Primary spontaneous pneumothorax is the most common in young adults and specifically male, while secondary spontaneous pneumothorax tends to occur in older individuals, and especially with someone underlying lung conditions that are COPD or cystic fibrosis, etc. Risk factors of this disease include smoking, genetic dispositions, lung diseases, underlying lung diseases, and stress or trauma-related diseases. Thank you, and if you find this information valuable, kindly like, share, and subscribe for more medical content.